to use cementless TKA. Do you have any experience, Sebastian, with cementless TKA in high BMI or in BMI patients?
I don't. We use cemented implants for everybody. It is still the gold standard. I certainly realize that there is a shift towards more cementless fixation, but I don't have experience. I would be personally more worried in the high BMI patients with cementless fixation. I would prefer using cement.
I agree. I think that the cementless fixation with high BMI patients is always a risky endeavor. I don't think we have enough data to conclude yet. Is it safe to proceed? So I stick with what we know around it and stick with the plan with this. Arnd, can you recall cases where you had to start with higher constraint from the beginning, or are you also aiming as low as possible and then increasing during the surgery?
So nowadays, as I'm now a bit more experienced than in the beginning of my training, I start, like Sebastian said, with the lowest constraint. And if there is a problem, I get all the systems in our clinic and I can do higher constraint if I want. So I remember one case where I also had this soft tissue damage, as you said, Michael. So I had a problem with the medial collateral ligament. There are some patients, and these are, in my experience, often high BMI patients where medial can lengthen during the surgery and get an instability. And there I can remember one or two cases where I had to do a higher constraint, like a semi-constraint, to solve that medial collateral ligament instability. So, but normally I